Hi, my name is Christian Ryder, and I am doing my presentation on hyperthyroidism, so let's just get started. Here is an image of the thyroid gland. It is a butterfly-shaped organ located just here at the base of your neck. The thyroid gland uses iodine from food we eat to make two hormones, triiodothyronine, T3, and thyroxine, T4. The two glands in the brain that assist in this function is the hypothalamus and the pituitary. They communicate to maintain the T3 and T4 balance. When either of these hormone levels are too high or too low, the body uses the negative feedback system to maintain homeostasis. The hypothalamus and the pituitary gland. So here is an image just basically giving you a breakdown of how this negative feedback system works. The hypothalamus is considered the master gland. It releases a hormone called the thyrotropin-releasing hormone, TRH, which sends a signal to the pituitary to release the thyroid-stimulating hormone, TSH. In turn, the TSH sends a signal to the thyroid to release the thyroid hormones, T3 and T4. A problem with any of these glands may cause an overproduction of the thyroid hormone and can lead to hyperthyroidism. Hyperthyroidism is characterized as a condition where there is too much thyroid hormone being secreted. The thyroid regulates the body's metabolic procedures, breathing, heart rate, nervous system, the body weight, body temperature. When the body's thyroid gland is overreactive, a person may start to begin to experience nervousness, anxiety, rapid heartbeat, hand tremors, excessive sweating, weight loss, and sleep problems. Here's a general overview of signs and symptoms that may be present with hyperthyroidism, including this excessive sweating and heat intolerance, increased bowel movements, the tremors, nervousness, agitation, weight loss, possible localized edema, menstrual changes, fine or brittle hair, thinning of skin, easily cut. The causes of hyperthyroidism. The most common cause of hyperthyroidism is an autoimmune disorder called Graves' disease. In this disorder, the body makes an antibody called thyroid-stimulating immunoglobulin that causes the thyroid gland to make too much thyroid hormone. Graves' disease runs in families and is most commonly found in women. Also, a functioning adenoma or a hot nodule. It's a pituitary adenoma or tumor in the pituitary, which usually is benign, slow growing, and typically arises from cells in the pituitary gland. They secrete excessive amounts of the thyroid stimulating hormone. Also, toxic multinodular goiter involves an enlarged thyroid gland, just generally enlarged. And it can end up being just very, very large, and you can have like a big lump here. Thyroiditis is general inflammation of the thyroid gland, and also excessive iodine intake can also cause hyperthyroidism, as iodine is used to create T3, T4. Here's just an image of the Graves' disease, what the thyroid would look like versus a normal thyroid here, a toxic adenoma. Toxic adenomas, again, they're typically benign. To diagnose hyperthyroidism, medical history and physical examination would be the beginning. A note of possible tremor in the fingers, overreactive reflexes, eye changes, warm or moist skin can be indicative of the disease. Next, the physician would want to run blood tests to check the TSH levels, T3 and T4 levels, and to see what the levels are ranging at, because you can tell whether or not it's hypothyroid, which is low thyroidism, hyperthyroid, or hyper, which is too much thyroid. A radioiodine uptake test is a small dose of radioactive iodine given to the patient. A high uptake of the radioactive indicates your thyroid gland is producing too much thyroxine. The test can be monitored every 2, 6, or 24 hours to determine how much iodine the thyroid gland has absorbed to create T3 and T4. Also, a thyroid scan, a radioactive isotope, again, is injected into the vein to allow visualization of the thyroid gland. And also just an ultrasound can be one of the basic images taken just to see if there's any nodules located there. For treatment, the best plan of care would be to target the hyperthyroidism, target the cause of the hyperthyroidism to find out whether or not it's a tumor, whether or not it's coming from the hypothalamus, the pituitary, or the actual thyroid, primary, tertiary, secondary disease. Beta blockers can be administered to reduce the heart rate, but they are not for everyone. Asthmatics and diabetics should be careful using these because they can aggravate their other conditions. Again, radioactive iodine can be administered as a form of treatment. The thyroid gland will absorb it, and eventually it'll gradually destroy the thyroid, which in turn reduces hyperthyroid symptoms because they are not producing T3, T4 any longer. Also, a surgery, thyroidectomy, total or partial removal of the thyroid, can also prove to be helpful, although a patient would, with a thyroidectomy being done, would have to take thyroid replacing medications probably for the rest of their life. And really quick, before we complete this, we will talk about the thyroid storm. A thyroid storm is a life-threatening health condition that is associated with untreated or undertreated hyperthyroidism. During a thyroid storm, an individual's heart rate, blood pressure, and body temperature can soar to dangerously high levels. Symptoms generally involve dehydration and hyperpyrexia. That is a fever that goes up to or above 106 degrees. Diagnosis can be confirmed by infection screen, chest X-ray, ECG, arterial blood gases, and pH levels. Treatment for a thyroid storm would be, an immediate goal would be to decrease the thyroid hormone synthesis, inhibit thyroid hormone release, reduce the heart rate, support circulation, and to treat precipitating conditions. Beta androgenic receptors are significantly increased with patients with this condition. So androgenic receptors should be something that we would look out for. And our last slide here is just going to give you an overview of sources used. Thank you so much for your time, and I hope you enjoyed the presentation.